This chiropractor from the Wellness Way is making a video saying that your doctor should not be trusted about healing from cancer. He makes a lot of misinformation claims, and we're going to go over a lot of them.
It's on the rise where colorectal cancers are extremely prevalent in young adults now. So what screening is your doctor doing? When's the last time they've ordered a 3-day stool test to assess levels of inflammation to the
I'm going to borrow this table that I took from a JAMA article. He is referencing the 3-day stool test, or the SENSA, which is considered one of the worst tests when screening for colorectal cancer. Forget the fact that a colonoscopy is considered the gold standard for screening for colonoscopy with sensitivity rates of 95% or higher. Even the other tests, such as the FIT test or other ones that you should ask your doctor about, have a way higher sensitivity than the SENSA test that he's referencing.
And if chemotherapy worked, well then why are we seeing more cancer development and especially more cancer production from the treatment itself, especially with certain patients with current?
I want to draw everyone's attention right here. Case report. World of research, not every article is made equal. Standing at the pinnacle are things like meta-analyses and systematic reviews, and at the bottom are case reports. Why is that? Because it looks at a singular patient. So trying to make recommendations based off one person is not a good idea for the general population. Even in the same article, it references that the incidence rate of acute leukemia, unfortunately, is roughly 0.2 to 0.5%. On the same vein, chemotherapy decreases the chance of recurrence by about 2 to 10% in the same period of time. The benefits still outweigh the risks, even though all those numbers are considered low.
Prior root canals and they're still intact, this can be a big sign of the lymphatic system constantly being congested by certain pathogenic bacteria which are directly correlated to breast cancer development and further autoimmune conditions.
I'm not a dentist. I know there's a lot of good research coming out about oral bacteria and various conditions such as heart disease, but he mentioned intact root canals. The first 3 words of the article he's referencing says infected root canals. I don't think he actually read the article itself. The fact that this article also references one person and then tries to make a generalization for a population based off that one person. I do not believe the Wellness Way has any patient's best interest at heart. These are actively harmful recommendations for not just an individual person, but also for public health. A chiropractor should not be giving dental or oncological advice to anybody. Don't get scammed. Take back your health.